Incivility in nursing usually happens in a negative workplace. In the timeless Disney movie Bambi, Thumper gives great advice. If you can't say something nice, don't say anything at all. Wouldn't the world and our work environments be better if we all heeded the wisdom of that wise little rabbit? I tried to ignore the problem of lateral violence in the healthcare workplace because I was embarrassed and a bit ashamed that this behavior could be present in our benevolent caring profession. We've consistently ranked #1 in Gallup's annual poll of honest and ethical standards for the past 15 years. How can we then be perpetrators of lateral violence? When a major nursing journal asked me to write an article on it with a specific title, I refused, saying I never wanted that phrase about nurses consuming their offspring to ever be uttered again. Yet the problem cannot be ignored. It must be addressed. I was shocked and mortified to learn that 45% of nurses had been verbally harassed or bullied by other nurses. 41% say they've been bullied by managers or administrators. 38% reported being verbally harassed by physicians. More than half of nurses who reported work harassment indicated they were considering leaving the profession altogether. Bullying and disruptive behaviors capture the attention of patients, providers, and visitors, which can extend to the community. Worse yet, it can impact patient outcomes. In a 2013 study in the UK, they reported that 1 in 4 doctors and surgeons and 1 in 3 nurses said bullying had caused them to behave in ways that were bad for patient care. 71% of doctors and nurses linked incivility to medical errors, and 27% tied it to a patient's death. So what exactly is going on, and how do we stop it? The Workplace Bullying Institute says bullying is repeated harmful mistreatment by 1 or more perpetrators who target their victims with conduct that is threatening, humiliating, abusive, isolating, and/or sabotaging. While some forms of bullying are overt, others are more subtle, such as teasing or saying something mean and then pretending it's a joke, turning 1 or more persons against one another, shifting loyalties, being friends one day and enemies the next, betraying confidences, intentionally excluding someone from an event or conversation, manipulating someone to do things in a misleading way, rolling eyes, sighing, fake smiles, mean gestures, using non-verbal intimidation tactics such as glaring or the silent treatment. It sounds kind of like our junior high days, doesn't it? Unfortunately, bullying can also be overt. For example, falsely accusing someone of making errors, criticizing someone in front of staff or patients, refusing to acknowledge quality work, starting or spreading malicious rumors or gossip, shouting or public humiliation, stealing credit for work, making unreasonable demands, sabotaging a person's work, refusing to help them, discounting the person's feelings or perspectives, or shaming them over lack of knowledge. Although anyone can be a target of bullying, often they are the coworkers who are the most positive, kind, cooperative, well-educated, and well-liked by upper management, and skilled at their jobs. These people are even more prone to suffer greatly at the hands of bullies, sometimes feeling embarrassed and inadequate. They can even result in symptoms such as stress-related health issues, of heart problems, anxiety, headaches, stomach issues, loss of appetite, insomnia, depression, panic attacks, or frequent illnesses. It can cause low morale, self-doubt, and low self-esteem at work and even at home. Some have trouble regulating their emotions or concentrating or making decisions, or generally dreading going to work, or feeling ill, feeling drained of energy, feeling helpless, depressed, or ashamed like there's no way out. It can even cause errors Some compromise productivity to avoid the bully. And it can cause reluctance to share ideas for fear of criticism or humiliation. But there are ways to address bullying and create a better work environment for everyone. If ever targeted by a bully, keep your cool and face this nonsense with grace and dignity. Try ignoring it the first time or two and say nothing and smile. That annoys the heck out of them. Sometimes when they see they can't intimidate you, they stop. Try using humor to deflect it. Ask them if they're having a bad day or if something's troubling them. If you feel your own aggression escalating, stay calm. Don't fuel the situation. Take a few minutes to breathe and regroup. And avoid rehashing it with coworkers. That can cause unit-wide drama and coworkers taking sides. If these simple strategies are not effective, it's time to take the next steps. Call it what it is. Acknowledge that you are being psychologically harassed. And speak up. Politely and quietly, call out the incident when it happens. State the problem and the possible consequences if it doesn't change. For example, if you continue to behave this way toward me or speak to me in this manner, I'll have to speak to our manager and make a formal complaint. If the behavior continues, follow through. I taught my kids the difference between being a Ralph reporter and a Tommy Tattletale. For the sake of a healthy work environment for all, you have the responsibility to report this conduct. Without action, it's unlikely the bully will change, and certainly not as quickly as needed. And document it. Bullies rarely treat someone badly in front of supervisors. Without obsessing about it, document each incident. Record the date and time of the event and what happened. And if there's any eyewitnesses, put them down. If bullying is digital or written, make copies. Before making a digital recording of abuse, make sure you reside in a single consent recording state, meaning it's legal to record someone's verbal exchanges without his or her knowledge. And then report it, my friends. Once you document the bully's behavior, take it to your immediate supervisor. If your supervisor is the bully, report them to your manager. When making your case, frame the issue on how it impacts care and productivity. Even though your emotional toll is legitimate, it's best to emphasize how the bullying affects team morale, work performance, and patient care. Unfortunately, you may expect some possible retaliation. It's likely the bully will hear about your report, and don't be surprised if they get back to you in subtle ways. Even if they've promised their managers they'll make amends. Record these incidents too, if they occur. And practice self-care. Being the target of bullying is very stressful. Be sure to make your health a priority. Be vigilant about getting good nutrition and sleep and exercise. Practice the stress reduction tips in my Self-Care for Healthcare program. Remember to use your skills of deep breathing, positive thinking, laughter, and forgiveness will be a critical tool, as well as connecting with your higher power. If you're not a victim of lateral violence, but you witness it, you can have an impact on improving your work environment. Derail gossip by switching subjects or injecting positive comments about coworkers, especially the one being harassed. Share positive gossip, good things you've heard, especially about the victim. When you hear suspicious statements, ask, do you know for sure if that's true? And before you repeat gossip, ask yourself, is it helpful? Would I say it if the person was sitting next to me? What's my motivation in repeating it? If this behavior is affecting your work environment, privately discuss your observations with your manager. Wise people have known for years that the secret for harmony in the workplace and every place is the golden rule. Do unto others as you would have them do unto you is the Christian version. But did you know that this rule is in most faiths? In Buddhism, hurt not others in ways that you yourself would find hurtful. Judaism, what is hateful to you, do not do to your fellow man. In Islam, No one of you is a believer until he desires for his brother that which he desires for himself. The Baha'i faith says, blessed is he who preferred his brother before himself. Though simple, this message is radical and contrary to human nature. Human nature is to treat others the way they treat you, but doing so puts them in control. Their behavior determines your behavior. The golden rule puts you in control. Let's control our own behaviors, communication, and workplace environments. Nurses and all healthcare workers endure difficult working conditions, often going for prolonged periods without food or drink, or even going to the bathroom in spite of my nagging. Perhaps worse, they generally cannot step away for a breather when emotions are running high or the atmosphere on the unit is tense. They have to stay and keep working, to focus on the patients who depend on them. But this is no excuse for disrespectful behavior. We are all responsible for creating positive, healthy, joyful work environments. Nurses must be able to work as a team, to depend on each other. We are empowered to keep patients safe, provide high-quality care, and deliver a positive patient experience. If bullying or incivility is a common occurrence in your workplace, these outcomes will be compromised. And we all took pledges to heal patients, ourselves, and each other. Let's do unto others as we would have them do unto us. And if we can't say something nice, let's not say or do anything at all. But sometimes even the simplest of concepts is difficult for an organization. To learn how we are shifting healthcare cultures towards civility, joy, and engagement, visit my website, selfcareforhealthcare.com. Fill out the contact form and set up a time to talk with me directly. I look forward to speaking with you soon.